Hello everybody, this is Farah Hati. I'm using Health Economics 6th edition by Santur and Noon. And this is chapter 9, Government, Health and Medical Care, lecture 1, the role of government in medical care. In chapter 8, you learn about market analysis. You learn about perfectly competitive market as an ideal, basically best market for um, um, maximum allocation of the resources, basically most efficient allocation of resources. And in the other extreme side of the spectrum, you learn about the pure monopoly, which actually the net gain of the market exchange in pure monopoly is smaller than perfectly competitive market. And you learn about the intermediate markets such as monopolistic competition and oligopoly with respect to resource allocation. Um, so you learn that perfectly competitive market leads to allocative efficiency, basically maximum allocation efficiency if the marginal private benefit is equal to the marginal social benefit and marginal private cost is equal to the marginal social cost. Um, this is based on basically Adam Smith's invisible hand, which believes that if each person follows his or her own basically individual benefit and cost, this ends up to the society's benefit and cost, which is not correct all the time, especially if we have the market failure and externality in the market. So in that case, we need a government intervention. Basically, if in chapter 8 you learn that if a perfectly competitive market it's relevant to the medical care, and you learn that we have a lot of market barriers and imperfect information, which are the characteristics of the perfectly competitive market, and we don't have perfect information in the market for consumers, and we have a lot of barriers. So therefore, if we have basically we don't have a perfectly competitive market in the medical care, why we are using the perfectly competitive model with the supply and demand model basically in the medical care? Because still we use the perfectly competitive model as a model, ideal model, and then we use still using the demand and supply basically help us to explain the rising healthcare costs during the past few decades in the United States. You learn about the monopoly, which basically fails to efficiently allocate the resources by setting the quantity lower than perfectly competitive market and setting the prices higher than the perfectly competitive market. And still, you basically learn that government is one of the basically cases to create these legal barriers to entry, which is one of the characteristics of the monopoly. So why government is creating these barriers, like the licensors and basically patents, you will learn in this chapter about the government's role in market basically intervention. Now, before that, remember that this is a scale of the degrees of market power that you saw in chapter 8. So in chapter 8, we talked about, is the market power a substantial and widening problem for the U.S. Economy? So based on these characteristics, the number of the sellers, and then basically the market share, and then type of the product and barriers to entry and buyers information, we can actually decide that whether we have a perfectly competitive market with zero market power, or we have a monopolies with 100% market power. And you learn that in the United States, the small practices, they can't afford anymore to run their own sole practice, and medical care is moving toward more basically bigger practice and organization by consolidation, and so basically the objectives of this chapter is to look at the role of government in the medical care when there are external benefit and costs. We look at the implications of various types of public sector involvement, the price ceilings and quality regulation, and then also we look at the government's perform the redistribution function and the methods of the, basically government involvement. And then also at the end of each chapter, usually we look at the impact of Affordable Care Act on government's economic role in the U.S. health affairs. Remember this chart we had in chapter 8, again, for analyzing different types of markets, and we said that we start with the basic condition of the demand and supply, and then we look at the three elements of the market: is market structure, conduct, and performance. And we said that there are two other factors outside impacting basically the three elements of the market. So one is the objectives of the market, whether it's a profit maximization market, or is basically quality or other, etc. And the other factors affecting the three elements of the market are the public policies. So which basically the focus of this chapter, looking at the public policy, how these public policies of taxes and price regulations affecting the market structure, conduct, and performance. Now, there are different types of government interventions. The first one is basically government provides public goods. Why? Because there is no incentive for the industry to provide public goods. And so even even if they want, they don't have, they can't basically afford it financially to provide the public goods. So basically that's the main role of government. The best example for public good would be it's basically public defense, and also basically environmental protection agency, and etc. Now, the government basically covers the cost of this public good by imposing taxes, and then also the government corrects for externalities. There are positive and negative externalities in the market that the governments actually try to improve the positive externalities and decrease the negative externalities, such as basically taxes and education and vaccination. And also the government imposes regulations, enforces antitrust laws, and operates public enterprises, and basically redistributes. There are so many programs the government sponsor, basically such as the redistribution of income. Now, there are two theories explains the government's interventions, so the economic reasons for government intervention. The first theory is talking about public interest theory, and the second is about a special interest group theory. So the public interest theory says that the government tries to promote basically the general interest of society as a whole. So basically promotion of the general interest of society as a whole, and restoration of the efficiency, and promote equity. Now, so basically the government's helping with the efficient allocation of resources where the marginal social benefit is equal to marginal social cost. Just pay attention, without government intervention, the marginal social benefit is not equal to the marginal individual benefit most of the time, and marginal social cost is not equal to the marginal individual's cost for basically any intervention or any activity in the market. So the government encourages competition, basically provides consumers information, and reduce these harmful externalities, and of course improves or encourages positive externalities and redistribute the income in societies. Now, in summary, the government's role is to enhance efficiency and equity through the laws and regulations. But there is a trick here. There is a trade-off between efficiency and equity. Means that if the governments want to improve or increase the efficiency, then they have to basically encourage the competition. And by competition, some people, they cannot basically compete. So therefore, there will be increasing inequality, and we are dealing with the problem of equity. So if the government wanted to take care of the equity, then basically is discouraging the efficiency. So there is a trade-off between efficiency and equity. That's the most difficult role of government, to keep this balance or choose the projects that enhance both efficiency and equity through the laws and regulations, which is very difficult. Now, the second reason, or second basic theory behind the economic reason for government interventions, is a special interest group theory. So the amounts and types of legislation determined by the forces of supply and demand means that any legislation, any piece of legislation in the government should be determined by the forces of supply and demand. Means that the buyers and sellers in the market determines what legislation should be approved, basically. So here, the supplier of legislations are mainly the vote maximizing politicians. So the buyers of legislations are wealth maximizing special interest group, basically. Now here, the overall fiscal package and political exchanges, basically for any piece of legislation and regulations and any interventions, should be basically very clearly determine the beneficiaries for that specific intervention, and who are the beneficiaries, who are the special interest groups that the government is trying to support, and what are the costs for basically that interventions. The cost usually falls disproportionately on the general public. Means that basically either everybody should pay equally for benefit of some specific special group. So this actually maybe is targeting the equity here, but it's going to basically have some inefficiency in the market, because the people say that why do we have to pay for those people? They cannot, for example, work. So that equity creates inefficiency, and so therefore any basically new intervention should be carefully determine the cost and benefit of that new intervention. So in the government, a careful cost-benefit analysis would have to be conducted before the basically winners and losers could be identified, and then the efficiency and equity implications should be determined for each piece of legislation. So that's the basically the duty and the task for economists, basically determine the cost-benefit analysis of each piece of legislation, and who are the winners and who are the losers for each intervention. Let's look at one basically government public good. So I selected the FEMA, which is the Federal Emergency Management Agency. We call FEMA, under the Department of Homeland Security, Department of Health, Homeland Security. Basically, looking at the website, you can see that their mission basically support our citizens and first responders to ensure that as a nation we work together to build, sustain, improve our capability to prepare for protect against and respond to, recover from, and mitigate all hazards. Means that if there is any man-made or natural disaster, so either a terrorist attack or if there is a hurricane, basically wildfires, we need actually a department to help us, right, against these man-made or natural disasters. So we have this department of FEMA to basically to help us to get back to the basically by preparation, protecting against, respond to, recover from, and mitigate all the hazards. Now, so if you look at the website, you see that the White House Office of Management and Budget requires the agencies to use the benefit cost analysis during the regulatory review development of any new proposal and project. Means that, you know, if there is a new grant programs for any basically new project, there should be a benefit cost analysis for that new program. So to determine who are the losers, who are the winners, and what are the benefit and cost of each specific projects. Now, yes, there are problems with the data and methods. You know, we don't have enough data, and we don't have a perfect method for estimating the benefits of, for example, terrorism attack. Security regulations are basically the data and benefits are insufficient to support the benefit cost analysis. But still, with the available data and method, you know, basically we have to still determine, you know, which project should be accepted and which should be rejected. So yes, the data is not available because we don't know if there would be any nuclear bomb, you know, in the future, next year or the next following year. And if it happened, hopefully it never happened, the probability would is zero, almost zero, right? Hopefully it never happened. But if it happened, the consequences would be very huge. They may actually target the basically medical care facilities. And if we don't prepare for that terrorism attack, then that would be a disaster. So therefore, there should be a preparation in advance in case of any natural or man-made disaster. So we have to allocate some resources in terms of public goods. So we have to pay taxes right now to prepare for you know, any basically man-made or natural disaster. So there should be a cost-benefit analysis for each programs. So this is called basically public good. There is no incentive for the industry to prepare for something that the probability of happening maybe it's equal to zero. So that should be undertaken by government. Now, the public good, there are some characteristics that basically determines public goods from the private goods. The public goods, there are non-rivalry basically in consumption, means that one person can increase the consumption of the good without diminishing the quantity available for others. For example, national defense. If, for example, I'm willing to pay my taxes because I'm actually worried about the future attack of terrorists, basically, I wanted to pay taxes for national defense, and there is another person who's not willing, actually worried and not willing to pay taxes, but there's no way basically to exclude that person if the public good basically created. Then everybody can actually consume, and then we can't exclude, you know, the people from consuming that. Or another good example would be basically healthy, basic clean environment, clean air and basically water environment that is basically also is a public good. If the government is working on the clean environment and we have to pay for taxes, that there is no way actually we can exclude who pays for that, who's not paying for that. So everybody has to pay taxes, therefore should be basically a mandatory tax for clean air and water, basically, environment. So these public goods should be produced, can be produced in either public or private, but there is no incentive for the private market to produce that, because there is no way you can exclude those people, they're not paying to use that and basically to charge differently. Therefore, there is a necessary funding, basically is collected through taxes to cover the public good, such as national defense or FEMA, for example. So the other reason for government role is the externalities. There are positive and negative externalities from sometimes in a market transaction, for example, by individual basically person can create the positive or negative externalities, which is not equal to the individual's marginal benefit and marginal costs. So a market transaction basically affecting parties other than the buyers and sellers, that individual person. So then this externality creates on price by product of the production or consumption. In that case, this is called externalities. So the buyers and sellers do not basically fully internalize all the costs and benefit of the transaction. So they don't take into account those externalities in their decisions. So the product is usually under or overproduced from a societal perspective. So the best example would be pollution, basically, as a negative externalities, and say that education or vaccinations as a positive externalities. So the demand side of externalities is when there is a positive, basically when we have a positive externalities is when the marginal social benefit is greater than the marginal private benefits. So the good example would be vaccination. Other example would be education. And when we wanted to decide to go back to college and basically get a graduate level, degree, the marginals we decide based on the cost of education, individual cost of education for me is like, for example, I'm paying for the tuition and transportation and anything related to basically my marginal cost of education and basically marginal benefit of education, how much my income will be increased basically, or the satisfaction I get from from this education. Maybe it's not even actually financial for the individual. But the point here is that the society from this education and vaccination actually get benefit more than the individual. So from the vaccination, when I get a flu shot, I also basically decrease the possibility of the other people to get the flu from me. And if I go to the graduate school and get this master degree, Master of Public Health, anybody around me will benefit from my basically knowledge when I'm interacting with them in the society, in the workplace, and in the society. So the negative externality would be the basically when the marginal social benefit is smaller than the marginal private benefit. This is the demand side of, we are looking at the benefit right? The benefit looking at the demand side. So the negative externality is the marginal social benefit is smaller than the marginal private benefit. So for example, cigarette benefit. When I'm cigarette smoking, when I'm deciding about smoking cigarette, just I'm looking at the marginal social benefit and marginal basically what is my marginal social benefit and marginal private benefit. And decide how many pack of cigarette I have to basically smoke. I decide based on my enjoyment of the cigarette and decide how many cigarette I wanted to smoke. But the society actually gets different benefit from this. So the smokers impose external costs to the society. So the smokers pay less taxes due to the shorter life expectancy, and also they have a higher healthcare cost. And then also the non-smokers even die prematurely from both passive smoking and smoking-related fires. So here we wanted to see how we can, so there is a basically demand side externalities. We wanted to see how we can impact, the government can impact the positive and the negative externalities by imposing the basically taxes on cigarette, so decrease the basic shifted demand to the left, and by encouraging basically the positive externality by probably subsidizing the tuition waiver for the graduate school or undergraduate universities, and by basic subsidizing the vaccination or basic even vaccination, flu shot in different public places. So that's the government intervention, shifting the demand to the right and left by the demand side externalities. So remember, this is the demand side externalities. There will be two types of positive and negative, and the government can actually intervene and shift the demand to the left and right if the demand, the individual's demand is not equal to the social, basically society's demand in terms of benefit. So graphically, the external cost of cigarette smoking is basically the market equilibrium quantity is at the point of basically it determines at the quantity 0, where the marginal private benefit is equal to the marginal private cost. So at this point, the person decides where my demand and supply intersect, and my demand is my marginal private benefit, and my cost, my supply is based on my marginal private cost. So I determine individually to basically smoke this number of the cigarette, Q0, and with the cost of this. But the marginal social benefit is much lower. It's there in the left, the demand. So the difference between marginal private benefit and marginal social benefits is the external cost. So which I don't care. As an individual, I look at my marginal individual's private cost and marginal private benefit and determines how many pack of cigarette I smoke with what prices. So yes, but the government, the government cannot push this part, but the government can actually change the price and impact the shift in the demand that I show you in the next graph. So an efficient allocation of resources here is in Q1, where the marginal social benefit is equal to marginal social cost, but individually I set my quantity at this point. Now, the demand side externalities has basically positive externalities and negative externalities. We talked about the negative one which is smoking. The positive externalities is like vaccinations. Most of the vaccinations have positive externalities, means that vaccinating one person can benefit so many people around that person. So this case, for example, if there is a basically there is a positive externalities by the rabies vaccination, so then here preventing the spread of the infection to humans or other animals basically has an external benefit to the society. The supply curve in that case reflects the resource cost of providing the rabies vaccine, with the marginal private benefits is basically equal to prices which is less than the marginal social benefit for maximization for vaccination. And so the efficient output is, some individuals place very little value on the vaccination because they put their allocation of resources based on the marginal private benefit, which is smaller than the marginal social cost. So too few vaccinations happen in the private market. So the government intervention would be basically either putting the mandatory requirement for vaccination or basically imposing fine for to increase the output. So in the case of external benefit of rabies vaccines, the market equilibrium output is at point Q0, which is the intersection of the demand and supply for individual. So it's a marginal, basically it is marginal private benefit and marginal social benefit, which is smaller than the marginal social social benefit. So this is the quantity and the price without government intervention, and then with the government intervention, we can actually push it over. So an efficient allocation of resources occurs at Q1 because the marginal social benefit is equal to marginal social cost at this point. And I show you how government can actually push the production in that level. Now, the supply side externalities so could be basically negative externalities such as pollution, which is created from a production process. It's negative externalities. So the marginal social cost of production here is above the marginal private cost. The producers, they don't care about the social cost of pollution. So the externality cost is the marginal social cost minus the marginal private cost, which is basically so the quantity determines for the individual where the marginal private cost is equal to the marginal social benefit, which is the marginal social cost basically is greater than the marginal social benefit. This is actually inefficient because the marginal social benefit here is smaller than the marginal social cost, or marginal social cost because of the in the pollution is greater than the marginal social benefit. And so we have to basically decrease the quantity, and graphically we show that this is based under the role of the Environmental Protection Agency. The government intervene and try to decrease the amount of production. In the case of negative supply externality of pollution, the market equilibrium without government intervention is at Q0, where the marginal private benefit is equal to the marginal private cost. At this point of, that's the individual basically decision without market decision, market equilibrium without the government intervention. So the market outcome is inefficient because here the marginal social cost is basically at this point, and the marginal social cost at this point is greater than the marginal social benefit. An efficient allocation of resources happens at Q1 where the marginal social cost is equal to the marginal social benefit. And so you will see how we can actually push the producers to produce at Q1 without, not at Q0 by imposing taxes. So the externalities of, basically could be positive or negative. So the government can actually impose taxes and subsidies. So to correct basically the market. So can be used to alter the price of the good and discourage the either the overconsumption or underconsumption. So the market participants are basically forced to consider the true net social benefit of their action. So this would be basically the tax shows them the real true cost or benefit of the market to the market participants. How we can do that graphically? We can show that a tax as a corrective instrument. Suppose that first of all, we have the basically in the without market intervention, we have this should be misspelled. Unaffected market results in an outcome where the marginal private benefit is equal to the marginal private cost at Q0. Marginal, basically. Private cost and marginal private benefit is at the point of P0 and Q0. The individual without government intervention is producing at this point. And so the efficiency exists at the point where the marginal social benefit is equal to the marginal social cost at Q1. So the tax is the vertical distance between the marginal private benefit and marginal social cost, which is the basically at point P1 and Q1, where the basically Q1 is smaller than Q0. Now, the government imposed the taxes by the amount of P1, P2. So in that case, so basically, we have the tax for amount of P1, P2. Basically here the consumers pays the portion of P1 to P0, and producers pays the portion of P0 to P2. And in general, basically, a tax depends on the elasticity of the demand and supply. Who pays more for the tax? Suppliers or demanders? Depends on the elasticity of the supply and demand. Now, remember that the burden of tax actually falls on the shoulder of suppliers and demanders, or demanders. The one actually has a lower elasticity of demand or supply. So that's always the case, because means that the suppliers or demanders, they don't have any substitutes. So they actually, the one with the lower elasticity pays the higher taxes. So that's the tax as a corrective instrument. So government regulation basically is a government intervention would be to correct a market imperfection. So basically because of the misallocation of the society's resources, right? So the government can control the market either by setting the prices or basically restricting the quantity or the quality of the product, basically affecting the quality of the product. Or government can actually control the entry of new firms into the marketplace, basically setting up barriers like basically patents or licenses. So let's see. The first thing is that government can actually restrict basically the prices. For example, government can set up a price ceiling, which is means that the maximum price that can be charged in the market. So This maximum price that can be charged in the market should be basically lower than the market price equilibrium. Let's see. When we have the market, competitive market, this competitive market with this pricing ceiling can create a shortage when the price is set, basically set it below the perfectly competitive market price, the intersection of the, below the intersection of the demand and supply, then this creates a shortage, and so may have actually consequences, basically. One of the consequences is the medical costs, basically, in the medical care can basically create waiting lines. For example, consider Canadian medical healthcare system, basically. Canadian healthcare system, they try to keep the price low, right? So therefore that creates a longer waiting lines in the basically for seeing a specialist or for surgeries, and or basically should be basically a non-price rationing. So basically there could be a reduction in the quality of care because they can actually take care of all the patients, so they have to reduce the quality of care. So graphically, when we talk about the effect of price ceilings in a competitive industry, so the without government intervention, the price and quantity would be at this point P0 and Q0, right? Intersection of the demand and supply without government intervention would be P0 and Q0. So the graph represents a competitive market for physician services in which a large number of insurers negotiate with physicians and determines the market price and outcomes of P0 and Q0 respectively, basically. That's in case of without government intervention. We have the equilibrium price and quantity at the intersection of the supply and demand. Now, suppose that government impose a price ceiling of P0, which is higher than the equilibrium the price ceiling, which is the lower than the perfectly competitive price. So the price ceiling here is at a PC is lower than the equilibrium price. So that creates, so it's basically cross the supply at the point of Q supply and cross the demand curve at the QD, means that quantity demanded with this lower price is at point of QD and quantity supply is at the QS. So therefore, the difference between QD, quantity demanded, and quantity supply is the shortage in the market, which is created with the lower prices, with this price ceiling, which is lower than the equilibrium price. So a price ceiling of PEC results in a shortage in the short run, which is equal to the quantity demanded minus the quantity supply. So that's the shortage. And again, remember this, a good example would be the specialists basically in Canadian healthcare system, that with the lower prices there is a waiting line, so there is a lower charge, maybe so the lower charge or lower price creates shortage. So therefore, what happened? A lower charge may be adjusted by say that length of stay in the hospital, if there is a waiting line for the hospital admission. So the providers probably they discharge the patients faster, sooner. So they decrease the length of stay in hospital, sooner than the patient is really ready to be discharged, or decrease the number of the patient, or they can actually decrease the quality of the services. And again, so that's the case when you set the price ceilings in a competitive market. Now, remember that the a trick here is that the price ceiling is only effective when it's lower than the perfectly competitive market price. So if we set the price higher than the equilibrium point, the price ceiling is not effective anymore. Means that it doesn't actually affect the market at all. So the price ceiling is only effective when it is lower than the market equilibrium price. Now the price ceiling, so the maximum price that can be charged basically now in the monopoly market without the restriction. So we basically, remember, the monopoly is set the quantity lower than the perfectly competitive market. So the maximization profit by producing at the point of basically quantity, which is basically at the point the marginal revenue is equal to the marginal cost, and basically at the price of P0. So the quantity is lower in the monopoly and the price higher than the competitive market. So with the price ceiling of the PC, so this price ceiling becomes the new fixed marginal revenue, and the supply amount of services as per the demand. Basically the price of the ceiling is less than the marginal cost, and here in that case the shortage appears. So so basically this price ceiling is creating basically kind of the quantity at the point where the monopoly is setting the prices, and quantity actually not the price is lower than the perfectly competitive market, but the quantity is lower than the perfectly competitive market. So so the regulations could be by setting the prices. The impact depends on the extensiveness of the third party involvement. So can actually lead to the shortage if the market is perfectly competitive, and the quality could be affected, basically directed at the structure of operation. So aimed at quality of the employees, raise cost of production, and can actually reduce the supply of medical services. So the regulation can target the price, can target the quality, and basically depends on the target. The next actually government intervention is the effects of the professional licensors. Suppose that initially the market for nurses is that initial market equilibrium occurs where at the employment N0 and wages of W0. So initially we are at the point 1 when the wage is W0 and the quantity employment for the number of nurses is N0. Now, when the government actually creates these barriers to the market by licensors, means that the licensing requirements increases the human capital investment necessary to enter the occupation and thereby reduces the supply from S0 to S1. If the government makes this nursing basically licensing mandatory, so everybody has to go to the school and take the 4 years of training. So this actually increases the human capital investment necessary to enter to the occupation, and thereby reduces the supply from S0 to S1. So there is a shift in the supply curve to the left, and then the price, which is the wage of the nurse is the price, is going to basically increase from W0 to W1 by shifting the leftward shift of the supply curve, and the quantity decrease to N1. And then the higher wage of the W1 creates an incentive for the professionals for those people they are interested to improve their job performance. So that leads to demand increases from D0 to D1. So basically, the wage or price of the nurse increased to W2, and the quantity of the demand for the nurse actually increased to N2. So basically, this is point C. So we move from 1 to 2 by the leftward shift of the supply, and then by rightward shift of the demand, we move to the 3.3. So if the demand shifts exceed the supply shift, so that's what we have in this. So in that case, so basically that this quantity of the basically employment exceeds increase. So the occupational basically licensing reflect an efficient policy serving the public interest here. So this is the end of lecture 1.